Today, we're at Trinity Health talking about a very serious health topic, strokes, and how they can be prevented. Dr. Farooq is an expert at that. Thank you so much for the time today, Doctor.
Oh, thank you, Todd. Thank you for having me.
Appreciate it. Strokes. Let's just start with the basics. Define how they happen. What is happening when someone is having a stroke?
Yeah, very good point. So Todd, stroke basically is when there is lack of blood supply to the brain, just as simple. So there are two different ways it can happen, either blockage in one of the main blood vessels in the brain or rupture of the blood vessel. So if there is any blockage, that we call ischemic stroke.
Okay.
And when there is a rupture of the blood vessel, it's called hemorrhagic stroke. And most of the strokes are ischemic strokes. Like approximately 85% of the strokes are ischemic stroke.
Which is the blockage.
Blockage
Right.
of the blood vessel.
Okay.
Can be large blood vessel in the neck or a small blood vessel inside the brain.
Okay, we say that strokes are preventable, but what you're describing to me doesn't sound like something I can prevent, because we're talking about things that are happening inside the blood vessels. How does one prevent a stroke from happening?
Yes, very important point, So this is very interesting, Todd. I'm glad you mentioned that because 80% of these strokes we can prevent.
80%.
Exactly.
Okay, how do we do it?
Yes, exactly. This is the main thing, right?
Yeah.
So we need to control the vascular risk factors. So just like high blood pressure,
Okay.
high cholesterol, diabetes, smoking, and avoiding any excessive drinking, drug abuse, or very important risk factor is sleep apnea. If somebody is snoring or has some lack of oxygenation during sleep, that can also increase the risk of stroke.
Okay, I want to stop you right there, doctor, because I don't think a lot of people know that connection. You're saying that there is a connection between the possibility of a stroke and someone who is suffering from sleep apnea.
Exactly, it is. It is very important, and now we know for sure from the data, from the research studies, that sleep apnea is also associated with abnormal heart rhythm, which is called atrial fibrillation. And AFib is a very important risk factor for stroke. And if somebody has like palpitations or missing a beat, they should consult their doctor right away to make sure it is properly taken care.
Well, getting a good night rest, that's important.
Very important.
We've been told that since we were little babies, right?
Exactly. I know, easy to say, hard to do that, right?
It sure is. Let's talk about when someone may be having a stroke. They may not be able to reach out for help themselves, so they rely on others.
Right.
What should the others, like us, be looking for?
Yeah, very easy method to remember, like what to do when somebody is having a stroke. It's called Be Fast.
Be fast.
BEFAST.
Okay.
Just as simple. So B is like for balance. If somebody has sudden loss of balance, lack of coordination, and E is for eyes. Okay. Sudden loss of vision in one eye or in both eyes, or even like what we call diplopia or double vision. Sudden onset of double vision can be a sign of stroke.
Okay, so you're talking when the eyes were swimming. Sometimes people say.
Exactly, right. That can be absolutely. And F is for face. If somebody is having a facial droopy face, and A is for arm, like arm weakness or numbness. We ask patients to do, lift their arms up, and if one arm drifts down, that can be a sign of stroke.
So just holding your hands up like this, if one just involuntarily falls, could be a sign of a stroke.
The same thing in the lower extremities, in the legs as well.
Okay.
So what we call drift, that can be a sign of stroke.
Okay.
And a very important one is speech. So somebody is having difficulty with speech or slurring of speech. So the last one is T, time to call 911.
So that's what the T stands for.
Exactly.
Time to call 911. Now,
Yes.
time to call 911 if you see any of these or all of these in.
Very good point. Can be any of these or can be some of these. Because depending upon where the stroke is, the location of stroke and which blood vessel is blocked, so based on that, can be any of these symptoms. So this is very important because many of those patients who have stroke, they don't have any pain, just like somebody has a heart attack, right?
Right.
So they have chest pain. They will call 911 and they will come to ER right away. Stroke doesn't cause any pain. Only 30% of the strokes will cause some headache. and most of the patients with stroke, they have no pain. So they just like wait at home, they don't call, or they will call their relatives or son or daughter, they don't come to ER right away. Because we can take care of these patients immediately, and we can give them clot busting medication within the first 4.5 hours. And also now doctors can go in to their brain with catheters.
I know.
Yeah,
It's
from
pretty
groin or
remarkable.
from the wrist, and remove the clot mechanically.
It's
so
amazing.
those things are very time sensitive. Sooner is better, because you will be surprised, Todd, that if somebody is having a stroke and we don't take care of that patient, in 1 minute they lose 1.8 million neurons.
Okay.
So that can cause significant disability
Sure.
if the stroke is not taken care in timely fashion.
Absolutely. So time is of the essence when it comes to this. When it comes to strokes as well, it doesn't hit all populations the same either.
Yeah, no, I'm glad this is very important point, because we need to be mindful of this, because we have seen that Afro-American and also Hispanic population, they have higher risk factor for stroke because of genetic factors.
Okay.
That is one of the reasons. And the other thing is awareness about stroke, about knowing the risk factors, about knowing the treatment, how to take care of when somebody is having a stroke. So that result in delay in coming to ER, and also having some delay in getting the proper treatment.
Well, we don't want any of those delays. We want to prevent this from happening, and there are ways that you at home you can take steps to help prevent a stroke from happening. And of course, there's a great place you can go to get that information: TrinityHealthMichigan.org. That's TrinityHealthMichigan.org for more. Doctor,
Yeah.
thank you so much for the time this morning.
No, thank you, Todd.
Appreciate
Thank you
it.
for having me.
Absolutely.
Thank you.